I know that you're the CEO and co-founder of Tali, right?
Yeah. Mhm.
And Tali AI is as a medical scribe, um, founded in Toronto, right?
Correct.
So I just wanted to ask, why AI scribe? Maybe you can tell us a little bit about yourself, to understand your journey prior to co-founding such an innovation in Canada.
Absolutely. So I'm a computer scientist by background.
Okay.
I studied at McGill and then came to Toronto for my first job at BlackBerry.
Yeah.
And that was during the almost a few months, almost a year before the release of BlackBerry 10, which was BlackBerry's response to iPhones at the time. So it was interesting to go through the ups and downs of the company with so many smart people. Certainly a very interesting experience for me as a first job. And I started my first company in 2015, which was also a software company in healthcare, where we worked with hospitals like CAMH and Unity Health to smaller startups like Caribou or Medassist. And we built their solutions from the ground up and helped them get their products to the market. And I think we built more than 40, 50 products at the intersection of basically technology and healthcare. And Tally started in 2019, early 2020. And the initial funding came from Public Health Agency of Canada. That they gave us funding to do research on state-of-the-art natural language processing algorithms to see if the accuracies were high enough for a voice interface on top of electronic medical record software for clinicians.
Okay.
And that is how the journey of Talia started.
Amazing. And you said, 2019, this is when you really dove into it. But you launched in 2020?
We um, we registered Tally in 2020,
Okay.
and that is when I started really interviewing doctors, nurses, pharmacists, asking them like, does this resonate with you? Is the vision something that you would eventually pay for? And as I was doing those research, WellHealth, that they're the largest clinic owner in Canada, one of the largest EMR providers, the company behind Oscar Pro, they got interested. They said that our vision is what they think is the future of healthcare as well. So
Okay.
they invested in Tally. They took a whole pre-seed round,
Okay.
but they also partnered with us to co-design and co-build the solution with their clinicians for over 2 years.
Okay.
And to your question, we actually went to market as a generally available solution early 2023. So before that, it was only released to select clinicians for pilot studies and iterations on the product. But general availability was early 2023.
Oh, okay. Because, working on this project or, getting close to launching it in 2020, that's during the pandemic, right? I
Yeah.
imagine that must have been a challenge. Did you find that, challenging compared to the other, companies that you've launched in the past? Just, during the pandemic that no one knew what was going on and we were all trying to figure it out. And at the same time, you're trying to understand, doing some market research, right? Understanding what really are the pain points and bringing the solution to the market. Is it exactly what the physicians need when it comes to relieving their administrative burden? So was that challenging at all?
Y- Yeah, so it was actually interesting because the problem we are addressing is physician burnout or clinician burnout. And COVID really made the problem 100 times worse. We were already in shortage of clinicians at the time before COVID, but COVID really made it much, much harder. Access to clinicians was very hard. There were a massive shortage of clinicians as well. So it was a really good time to actually uh, uh, promote the idea that there is technology that might be able to help here.
Okay.
But you're right, because it was the whole healthcare system was very overwhelmed.
Yes.
with the urgent requests and requirements of the pandemic,
Yeah.
it was hard to find clinicians that would give their time to us for interviews, for pilot studies. That was the difficulty at the time. Yeah.
Okay. That's interesting because I know that a lot of the AI scribe companies that I see, they're emerging in the last year or two, you know.
Mhm.
But it's good to know that Tali has been in the works, or launched in 2020. That's at least 4 years. So it's not like you launch your product during the hype when everyone's talking about AI and you're just trying to jump on the bandwagon. You were
Yeah.
doing your research to make sure that you could bring something, a very different value proposition to the physicians. Now, most of us on social media space, in terms of, well, I'm not a health professional, but most of the physicians that I see on LinkedIn and social media, they're aware of what AI scribe is.
Mhm.
But for those who don't understand what the platform does or what your product really does, are you able to maybe shed some light and just dumb it down for for us,
Absolutely. So, as patients, when we go see our clinicians, we have probably seen this that as soon as we start talking, they turn their back to us and they start typing. This is because they have to document everything we're saying in a specific format, usually referred to as a SOAP note, as a basic format. And basically, the subjective part is the narrative that the patient is telling. The objective parts are the measurements done in the room, the assessment they have, and the plan. What do we want to do? Like, is there a prescription that needs to be sent, or is it lab requisition? And so all of this is only a part of the documentation. After that, they would have to fill out lots of forms, and it adds up to about 15 to 20 hours of documentation and administrative tasks that a physician, usually a family physician, would have to take on. Just imagine some of the most educated and valued resources in the country are losing so much of their time on mundane administrative tasks. So we tally next time as a patient, if when I go to my doctor's room, they turn on, they obviously ask for their consent. They say, hey, I'm using this AI technology that helps with the documentation.
yeah.
More than 99% of the patients are okay with this. So then the physician would turn on the Tally's basically it clicks on the recording. Tally will listen to the whole conversation between the clinician and the patient, and then documents and put the information into the patient chart. So this is going to save anecdotally from our physicians about 2 to 3 hours of their time per day on documentation and admin work. But on top of that, there is a massive benefit in terms of cognitive load that the physician needs to take on during the day, so they feel much less tired at the end of the day. It's the attention they can give to their patients, having FaceTime with them, and all of that. So it's a very multifaceted value prop that this technology has.
Amazing. Because I work with physicians to, help them find the right type of tools, especially AI tools to just improve their workflow, right?
Mhm.
And just listening to that, because, when I work with these physicians, I usually ask them at the beginning, before we even dive into finding the tools that works best for them. I usually ask them, what problem are you trying to solve? Because sometimes AI really isn't the solution for them, right?
Mhm.
And it could help them absolutely, but it might not be the ultimate solution to their issues. I worked with a pediatrician where she had close to 60 different templates for 1 month checkup, 2 month checkup. She had so many templates that she was using, these template generators and so on. So when it comes to having a tool that can help them just focus on the patient and not have to worry about the notes that they have to type in, or they take a sheet and finish it later. So I usually ask them, what's your initial reason for using a tool like this, and is it because you want to be able to see more patients at the end of the day, or you're just trying to leave early, or you don't want to have to think about the writing notes during your session. You mentioned cognitive load, so I'm just adding to that, that working with the physicians, I see that it's a huge benefit, and the ROI that they get from this, it's really vast. There's a lot of different. It just depends on the physician. You know what I mean?
Yeah,
So one physician would prefer to just leave early, and the other one would prefer to see more patients. To each their own.
absolutely.
Um, and in terms of EMRs, because electronic medical records, as we know it, we have quite a few in Canada. Um, now I'm thinking the EMRs are definitely looking into getting into the space, however possible, whether it's through acquiring a platform like yours, or building in-house and so on. Is that a concern of yours, or have you guys, has Tali started to integrate with any EMRs in Canada or Quebec?
We believe in the power of partnership. We think no piece of technology can live on its own independently. Like the clinicians are asking for interoperability and seamless integration between different technologies they have. So integration has always been one of our main pillars of growth and pillars of a strategy. So through our partnership with WellHealth, Tali is integrated with or is making the integration with all of their EMRs, Oscar Pro, Profile, all the other EMRs, and on the TELUS Health, then we signed the agreement in end of 2023 to be the official AI scribe for PS Suite, MedAccess, CHR, and in Quebec, MediSync, which I think is
Oh,
close to
wow.
50% of the market
Yeah.
in Quebec. So through this partnership, and we have just signed with QHR as well, the other big player in the EMR space in Canada. So through these partnerships, the benefit that clinicians get is that in the first phase, they can launch Tally directly from their EMR, so they
Yeah.
don't need to install anything. And then their integration is synced, so they don't need to log into Tally and their EMR separately and log out, because in a lot of cases, clinicians are going from room to room, or they're
Yes.
sharing a room or a desk, and it's a hassle to have to log out and log in every time.
Yeah.
And then after that is that when the note is generated, so Tally listens to conversation, generates the note, they can review the note inside Tally, and then when they approve, with a single click, all the different parts of the EMR will auto-populate. So they don't need to copy paste the note from Tally to the EMR, because EMR at the end of the day is the patient chart and where the note needs to exist. So through these integration levels, as we go deeper, there we're going to save more of clinicians' time. What's
Yeah.
by saving more clicks
Yeah.
from their days, and also making their workflow a lot more seamless.
Okay, yeah, that's really interesting, because a lot of physicians that I work with, they usually ask, one of the first questions they ask is it synchronized with my EMR?
Yes,
And I say, well, at the moment it's just a copy paste, which is relatively quick, but at the same time you want to be in one environment when
exactly.
so you're using your EMR regardless of whichever EMR. You just want to make sure that you're not going left and right, and some physicians are used to doing that, so that usually hinders or slows down the adoption rate when you bring a third party like an AI tool or a template generator like text blaze and so on, because they don't want to have to go outside of their EMR to be able to write their notes.
Yeah.
Yeah, so this is the integration. I think would be a massive benefit to physicians.
Mhm.
In terms of one thing I noticed with Tally, because I've piloted it myself, or tried it out myself a few times, is that you have the ability to offer just dictation um, services to the clinician. Well, your platform is based on voice recognition, right? So, but if a physician is skeptical about confidentiality, or having to take consent from patients, because sometimes it can be a tedious process depending on the AI tool that they use. If they don't want to have to take consent, then they can just dictate the note after the fact. So after the patient leaves, during the conversation, they take a cheat sheet, write a few notes, and then develop it afterwards. So I noticed that with your platform, you offer the dictation part of it, and also transcription. So if they wanted to actually use it when the patient is in front of them. So which package do you see that the physicians tend to use more, and which one benefits them more? In terms of live transcription with the patient, as opposed to just using it as a dictation tool, because some physicians are used to using
Yeah.
Dragon, right?
Yeah.
Yeah. So
More than 95% of our paying customers are on the AI scribe model.
okay.
And the dictation, to be honest, was more of an auxiliary service to the AI scribe. So, because in web-based EMRs, whenever you click on a text area, you can then dictate directly into the EMR. And that was supposed to support for cases where there is a letter they want to send that's not as part of the core functionality of AI scribe yet, and they just want to finish their note, maybe add a sentence here or there. But you're right. Some of the clinicians, if they're not comfortable, I was just talking to a fertility clinic,
Yeah.
and they were like, we don't even want to risk asking our patients whether they're
Yeah.
comfortable with us using an AI. So
Yeah.
what they're doing is that they're not using the dictation, they're still using the AI scribe, but the way they use it is that they will let the patient leave the room. Then they talk to Tali as if it's a virtual a scribe. So
Mm.
they turn the AI scribe and then they talk to it. It's not a dictation. They will say, well, the patient came in, they had this problem, that problem, etc., and then give a summary, and then Tally will basically format it to the specific requirements they have for documentation. So that is also saving a lot of time, obviously, not as much as if they would record the transcription,
Yeah.
but that is what happens when people can't take the patient consent. Dictation is usually that kind of an auxiliary service, as I said.
Okay. I was going to add to that in terms of the dictation, you package it, it's also cheaper, right? A physician who chooses to use only that feature
Yeah.
instead of paying X amount for a Dragon or Microsoft a tool, they can just use Tally for that. I mean, I'm not sponsored by by Tally or
No,
anything, but I've seen the product, and I think it's a great addition to the number of tools that physicians can use.
that is true. And when we initially launched it, we were thinking exactly like you, that even if they don't want to use the AI scribe, dictation is something they already use and it's
Yeah.
much more accurate.
Yeah.
Doesn't require specific hardware. It's like doesn't require fine tuning with their voice, all the issues they had with Dragon,
Yeah.
and a much cheaper price. So it's a no-brainer. But as
Okay.
I said, like more than 95% of our paying users are on the more expensive tier of AI scribe. So we're actually designing an iteration on our pricing model where the cheaper version is still going to have some limited usage of the AI scribe plus dictation, because we are seeing that more and more as clinicians get educated on the benefits of AI scribe,
Yeah.
very few people are still interested on dictation alone.
Okay, interesting. You said that, and I was thinking of a physician a pediatrician that I've worked with in the past for close to 5 years. He works at the Emerge at the Children's Hospital, and everywhere he works, he's really an emergency pediatrician, right? And he is one of those physicians that is quick and is very efficient. When I get feedback from the patients that have seen him, is very quick but very efficient, right?
Yeah.
And patients are always happy. So when we talk about AI, and I'm like, well, you're very fast. Maybe your consults are probably 5 minutes or less. Is a tool like this really relevant to you?
Yeah.
And he laughs and he shows me his previous notes prior to using AI scribe, which was just short sentences, 2 or 3 sentences,
Yeah.
and that's it. Right. And then he uses an AI tool like yours, and it gives him a nice generated summary and so on. So that was a very interesting use case that I saw where you know just you don't need it to alleviate stress or anything, but just for better quality notes. Are there other use cases that you can talk about for physicians that are not aware?
No, that is exactly right. Like the quality of the note is helpful to clinicians from a few different angles. One is liability. If an issue happens in the past and a patient opens a case against their physician, they have very detailed notes of what happened during the visit, what was their assessment, what was the discussion with the patient, etc. So we're seeing that a lot of physicians are actually interested in that, that it gives them more protection. The second is the billing part of it, is that when the documentation and notes are more detailed, there is more opportunity for billing codes that and Tali does this right now, that we offer billing codes that apply to a certain visit and maximize the revenue for clinicians in that sense as well. And the other thing is that when you're collaborating with other physicians, so if you are a specialist and you're sending back a consult note to a family doctor, or a family doctor sending a referral letter to a specialist, and Tally generates these letters as well, it's a lot more detail. So it gives your colleague a lot more details about what happened during the visit specifically.
Yeah.
They have the option to, because Tally can be fully customized, and we're seeing that sometimes clinicians are customizing their notes that even they include patient codes specifically inside the letter they send to the specialist or back from a specialist or to the family physician. So yes, I think the more we document exactly how the visit happened, what was the narrative of the patient,
Okay.
the higher the chances that the quality of care is going to be maximized.
Amazing. I mean, these are use cases that are very valid, and I'm sure you've seen the influx of 100 different AI scribes that have been,
Yeah.
you know, that are in the market now. And so, a physician looking out there for what works best for them. One thing I always tell the physicians is, even if there's two of you and you're both in the same specialty, the one AI scribe might not work. The one that you use might not work for your colleague, because
Yeah.
it's almost like a personal preference, and it depends on your workflow, how you work, and how you like your notes to be generated. Do you use templates and so on? Do you like to have forms incorporated in some of your visits? So in terms of templates, is that something that you guys are working on? You're planning to deploy, or you already have it fully integrated? So if a physician is asking, can I use templates when it comes to Tali AI? What would you say to them?
So the answer is yes. The something that um, is important to notice is that this is a space that's moving really fast. So if you have tried a product, I'm talking to clinicians, if you have tried a product 5 months ago, go try it again and you will be mind blown, both in terms of accuracy and note quality, the template support, the customization support, everything. So, like for example, with Tally, we have a release almost every Thursday. So just imagine something gets better in the product every Thursday. So that is how fast this market is moving.
That's exciting.
Um, yeah, but for like you're right, there is a lot of competition
Yeah,
in this space now, and the reason is that the demand is very solid from the market. Physicians want this, and it makes sense. So I think if I were a clinician and I were to choose an AI scribe, this is how I would look at it. I think the first and the most important part for clinicians from our experience as we interview them is accuracy and note quality. So accuracy of the voice to text given different accents and different room environment, whether there is noise in the room, etc., or different clinicians talking at the same time,
yeah,
that is the core part that actually enables every other functionality inside the tool. So if that is not done right, if the voice to text technology is not good
yeah,
and high performing, the rest wouldn't matter as much. So that is the first. And then the note quality. This is something that, like, for example, at Tally, we spend a lot of time on over the past 2, 3 years. We have developed this rubric internally that we're because we're documenting millions of patient visits every year, and we're basically automatically measuring on certain metrics. How is the quality of this note? One of them is that, is there any missing details? Is there hallucination inside the note? Is the language professional? Meaning that if I tell my doctor that I have a stomachache, my doctor won't write stomachache in his note. He will probably write something like abdominal pain. They will use more medical language. So professional language, is there professional language? Is the relative section, so something that should show up in the objective is not going to subjective. So there are certain metrics where we measure the accuracy of the note and note quality with. And that's why when USVA did a study of many of the solutions globally, Tali was ranked top 1% in terms of note quality and accuracy. And it was an interesting study because they actually looked at very long audio files, like 30, 35 minutes between a clinician and a patient. They had accents, there was noise in the room, and then they looked at the last note that was generated.
Okay.
And measured scribes basis. So I think note quality and accuracy we still think is the number one important factor for clinicians, because like if you note is generated and you have to make 10 different edits on that, it doesn't really save your time as much.
Okay.
The second is, I think, the integration with the EMR. We're seeing that to be the most important, especially for enterprise deals. When we're dealing with a clinic group or a larger deal, integration is a must, and most of these organizations don't even entertain a conversation with an AI scribe or a technology that's not integrated. And that's why this has been a main area of focus for us, to be integrated to the EMRs. Customization and personalization of the note, as you said, is very important. So we have, over time, we have released so many different templates for different specialties, from psychiatrists to physical therapists to social workers to pediatricians, etc. But on top of that, they can go ahead and customize Tali's templates to no end. So they can basically give natural language instructions on how they want their notes to be modified, and then Tali will write the notes based on that moving forward. So this is another area, like we realize that clinicians are very much attached to how they want their notes to be written, because it's not just about when it's written. They should be able to go back to their notes and quickly read it the way they are used to read the note.
Right.
And that's why customization is important. And then language support, obviously.
Yes.
We started with English. We quickly added French. I think we were the first company to support French. And then Spanish, and now Farsi. And for us, language support is not just a matter of turning on a setting. For every language that we support, we hire dedicated annotators that go through medical text in that language and help us annotate and improve the accuracy over time. So that's why we don't say we support a million different languages and we fail at all of them. We select languages, but we try to do a good job. So right now, Tali supports English, French, Spanish, and Farsi as the first 4 languages.
You talked about languages. That is something that is so key. I've had to pivot, so I'll just run you through how I consult with my clients, which are physicians. Is so the first initial meeting is, so we spend an hour understanding how the physician works, what's their different workflows, how many clinics or locations or sites do they work at, what type of patients do they see, how many consults, follow-ups. I get into the nitty-gritty to really understand which tool is going to fit. So once I understand the workflows, then I pick 3 of my top 7 to 10 2 AI scribes that I've been demoing with physicians, and I've done my comparative analysis. And so we try out the 3 different AI scribe in a span of, it could be 3 weeks or a month, depending on the physician. And then they end up choosing which one works best for them. So they know that they're ultimately choosing the best of the best in the market, right? And so a question that comes up always is language. I don't want to have to think about turning to English my input and output language, right? So my input language being the conversational language, what is it going to be, as opposed to the output? What's my notes final output going to be? Is it going to be French, and so on? So sure, I can always make sure that my notes are in French or in English, speaking as a physician in Quebec, um, can I have an AI tool, or does Tali allow for auto detect, meaning that I don't have to think about a language, you know? So if you support French, English, Spanish, can I just select multilingual feature, and that just I can switch back and forth with my patients in English and French, because in Quebec that happens all the time with all the
Absolutely.
physicians that I speak with. It doesn't even matter the region. In Quebec, it's always a franglais conversation. So is that possible?
Yeah, exactly. If you go to Tali's setting, you'll see that I can choose English or French, or there is another option called dynamic language, and that's exactly what you're referring to. Is that if you
Yep.
switch between English and French, Tali will switch with you as well, and then generate the notes either in English or French.
Okay. And so since you support these three languages, very, so you're the expert on those languages. If a physician, because I've had physicians ask me, I'm looking for a tool that can transcribe in Hindu, or Punjabi, or Persian or Dutch, or very specific, different languages. So what do you say to physicians like that? Is that something that's just coming down the road?
Yeah, I would just ask them to wait a little bit
Okay.
longer. And
Okay.
it is coming. Yeah, it is
Ah,
coming very soon.
okay.
We're actually deploying a new model platform by platform. So it's released on our mobile and our web app.
Okay.
And this new model actually supports a lot more languages, but it's not released on all platforms yet. But so hopefully in the
Okay.
next 3 months, all languages will be supported.
Okay. A few minutes ago, you were saying some very key things that physicians should take note of when they want to choose a tool, right? An AI scribe, and you mentioned hallucination. That's the biggest. So funny. I wrote an article, a newsletter on that, which is going live today, on hallucination, because I've had physicians pivot from one tool to the other, because and if you read my article on LinkedIn, you would see that it really doesn't matter. Every AI tool that I've piloted hallucinates, right? It's just a character of how these models behave. But one thing that I noticed is that templates, if you as a physician, you spend some time creating templates for your different, whether it's your migraine visit or your stroke visit or whatever it is, headache, that really eliminates or reduces the percentage of hallucination. Is that something that you guys have noticed from your end? What do you advise physicians when it comes to hallucination and using Tally? Is that something that is very frequent with your platform?
It's actually not. And it was one of the first thing that we spent a lot of time on because the liabilities of hallucination is much higher than any of the other mistakes. Like if the section relevance, for example, as one of the metrics, if an information shows up under objective versus subjective, that's also a big deal, but it's
Yeah.
not as significant as AI just making up its own details in the
Yeah.
visit. So we have spent a lot of time on that, and the number of hallucinations that are happening in the visits are very, very rare. But you're right. Something that does help is if the clinician details out for example, gives a summary of who the patient is. Through the integration, something that's happening, for example, with CHR, one of TELUS Health EMRs, is that we get the patient context,
Okay.
and getting the patient context reduces the chances of hallucination even further. But if not, we sometimes ask clinicians to give a summary of who the patient is at the beginning, and then the visit starts. That also helps with the hallucination a little bit. So there are tips and tricks like that, but the rates of hallucination, at least on Tally, is so low that it hasn't been a concern that we keep hearing from our customers that much.
Amazing. I think that's a really big game changer.
Yeah.
Physicians don't know about it until well, I'd say some physicians, they don't know about hallucination when it comes to AI until they try it, and then they freak out, understandably so, because it's like you said, it's a huge liability.
Yeah.
And so if the AI tool is mentioning things that weren't discussed with the patient, then you lose confidence in the platform, right?
Yeah.
So it's good to know that with your platform, it's very minor, but to be able to fix that, if for the 1% that happens, you can use custom templates, right?
Yeah.
Are
Of
you
course.
able to incorporate forms? Um, in Quebec, we have SAQ forms or CANSST forms and so on. I've had physicians ask me this a few times that, hey, maybe I do an expertise clinic and it takes me 3 hours to complete my notes. And there's different sections in the forms that I want to be able to capture during the visit when I review the supporting documents, and when I'm writing my final, diagnosis and conclusion. Am I able to use Tally to do something like that?
Unfortunately, not today. This is something we're working on. We
Okay.
know and we hear from our physicians as well that it's top of mind for them. We are
Yeah.
working on it, and hopefully, in the next few weeks or months, that will also be released.
Amazing, amazing. I mean, granted, it's most physicians know that it's not. They don't rush to using tools features like that. They just want something that is simple that can just
Yeah.
capture the patient conversation. So I demoed a product from the States. I'm blanking out on the name, but I notice when it comes to consent, right? The workflow of consent, I don't find very streamlined with most of the tools that I've seen, whether these are providers out in the US or in Canada, meaning that you want your patient, most physicians would want the patients to receive the consents beforehand, um, and agree or disagree, to allowing the physician to record the conversation prior to showing up in the clinic. So how do you guys address that when it comes to consent, or you provide a sheet to the physicians and they can implement it however they want?
So consent is can be written or verbal. We're seeing that a lot of our clinicians are putting a signage at the admin desk that basically the patient will see and know that the iScribe is being used, so they make it opt out. Some others make it opt in, so they explicitly ask, "Are you okay for their physician to use an AI scribe?" Nevertheless, we have prepared an FAQ document. It's 2-3 pages of frequently asked questions that we ask our clinics to copy, print, and put it in front of patients. So regardless of whether you do it opt in or opt out, they can read through the FAQ and know what they're giving consent to, what is this technology, how the information is managed, what pieces of information are collected, all of that.
Okay.
So I think that education before the consent gathering process is very important. And some of our clinics are actually doing that before the patient even comes to the clinic. So they send an email, they inform them about this before they come in to the clinic, so they have time to do their research, etc. Um, the consent gathering process, a lot of the clinicians are asking, can I add a line at the end of my note that says the patient consent is taken? So during the customization components that are in Tally, they actually have that option. They can say, every time the patient consent is taken, just add a sentence at the end of the note that says do that. So a lot of clinicians are actually doing that right now.
Yeah.
But I think in terms of I'm seeing a lot of the patients being very comfortable, like more than 99% of
Yeah.
patients comfortable with AI scripts.
That's right. That's right. Yeah, and you're saying if the physician can write at the bottom of their note that the patient gave consent. I think that's something, because in Quebec here you have the CMQ, the Collège de Médecins. They wrote an article where they just gave advice to the physicians, because there's no solid regulations, but here's the best practices, and one of them was, if you're going to go ahead and use a tool like this, you should take note of the consent element of it, meaning that if in the privacy policy of these tools it's mentioned that they use the conversation to train their AI models, then you need to make sure that you get explicit consent, meaning written and signed by the patient, and not just a check that says I agree. But if that's not the case, if the AI tool isn't training their models using the patient interaction, then you can just write it in your note. I personally usually just tell physicians that I work with, just get explicit consent.
Yeah.
So you don't have to think about it. I think that's best practice overall. So it begs the question, about Tali. Does Tali, use the patient conversation to train their AI models? Is that something that you're able to share?
Not the patient information. So,
Okay.
as you know, we usually refer to this information as PHI and PII
Yeah.
in healthcare. And prior to doing anything with the conversation and the note, we de-identify the note. So we redact all the patient information and the identifiable informations of the patient from the note.
Okay.
So no, we don't. And based on the regulations, when you do a proper de-identification on the note,
Yeah.
uh, then you actually don't need to get that consent from the patient explicitly. But regardless, similar to you, we do advise, and we always say that they need to get very clear consent from the patient. The patient needs to know that this technology is being used. The other thing that's important about Tally is that we don't keep the audio file, which includes the
Yes.
biometrics of the patient. So we immediately drop the audio file. We are overall very, very, have been very cautious about security and privacy. So we are the only AI scribe in Canada that's SOC 2 Type 2 certified. This means that all of our processes and also our technology, our architecture design, everything is reviewed to be HIPAA compliant. And for us to keep our certificate, it's not just about the review of our technology periodically, it's also about every employee is periodically trained to understand the requirements of working in this space. All of our internal company processes are also observed. So this is a very high standard that we are keeping ourselves accountable for, and I'm very proud of that. It's something that is it's very top of mind for all of us.
Amazing. Yeah. No, I think SOC 2, it's for the tech guys and girls out there, that's very it's important to have. It is nice to have, and it just brings more credibility to your platform. Because we're talking about consent, and I'll share with you an experience where I piloted the tool with a few different tools with close to 6 to 8 different physicians in the same clinic. And what I noticed is, right, so AI Scribe is here to alleviate administrative burden. And so physicians will spend less time. We want to cut their time writing notes and so on. But at the same time, we don't want to shift that time to the administrative staff, right? So having the secretaries or the receptionists in the front getting the patients to sign the consent form, that takes a few minutes, right?
Yeah.
And not every clinic is willing to invest that time in taking those notes, because let's face it, the ROI is directly felt by the physician and not the clinic. That's why most clinics won't really pay for a group package for the physicians, because they allow the physicians to pay for themselves, unless the physician plans on seeing more patients, right? So it makes sense for everyone, depending on where you work and the structure and how it's set up. But when it comes to you know inherently shifting that time saved slightly to not all of it, but just a fraction of it to the administrative staff, is that something that you guys are looking at addressing? Maybe you, Tali, would be sending this consent to patients beforehand. Is that something that's has been talked about with your team? If you're planning to work on,
Absolutely. We're seeing that sometimes it's the EMR company that's taking on that process.
yeah,
Some other times it's been us that have helped with that. But absolutely, we are thinking of automating that process for sure as well. The problem is that right now Tally doesn't have channel to the patient. If there is a communication that needs to happen to the patient, it needs to go through the EMR. And some EMRs do have that, some others don't have it. So it's a process that needs to be standardized across different EMRs, but certainly something that we have heard from our clinics as well, for sure.
Okay, because I can tell you right now, and a lot of clinics would be more inclined to entertaining this technology if you have something like this address, rather than having the front desk where they're already trying to alleviate the pressure and
Yeah.
time spent answering answering phones and so on. Yeah, they don't want to transfer that to their secretaries. We talked about the value of Tali and what it does. If a physician were to ask you, yes, there's 100 different AI scribes. What's the main value proposition, that why should I really choose Tali out of all the different products that are out there?
What I keep hearing from our clinics when we ask them why do you choose Tally, they tell us it's the maturity of the product and maturity of the team.
Okay.
So the as I said, all the things they said about the accuracy, note quality, the product being easy to use, SOC 2 Type 2 certification, all of that, but also after the product is at physician's hand, the maturity of our customer success function, the knowledge bases that we have prepared. We have a community of physicians that use Tally, that they all go there, they share tips and tricks with each other. So I think these are all very important. We don't look at a product as a single transaction, but as a very long time collaboration and partnership with clinics.
Okay. So I think this is a question that is I'm not sure if people are asking a lot, but are there any features from your perspective as a provider? What is the best integration process or onboarding process for a physician? Like just in under a minute or 50 seconds. If you're advising a physician, you want to use Tally, how should you go about it? Should you focus on templates? Should you focus on buying a nice, maybe a podcast microphone so that it captures sounds if you have five people in the room? What would be the...
Tally works with any default microphone. So whatever you have in your desktop or laptop, that's great. If you don't have any microphone, Tally has a mobile app that can be used as a microphone. So you can just download both on iOS and Android, and then turn it on mobile. Tally mobile will capture the conversation, and then it's synced with the other platforms. So that's on the platform. Tally has 2 weeks of free trial. So the first suggestion is, and for that you don't need to put your credit card or talk to us at all. Just go on our website. Under 2-3 clicks, you will be started to use Tally, and you will get an idea of how it saves your time, what's the quality of the voice to text and the note, etc. And if in a larger scale you want to implement Tally, we have this program called White Glove Program, where a dedicated account manager will work with the clinic. There are group trainings and one-on-one trainings and everything. So Tally is built as a self-serve tool, so most of our clinicians don't require any help, but we regardless support all of those to make sure that they get the most value out of the product.
Amazing, amazing. I know that we're running out of time here, but I'm just curious in terms of 2025. Are there any exciting new features that the physicians or clinicians in general should be expecting?
Yeah, I think 2025 for Tally is going to be the year of a lot more partnerships
Okay.
with EMRs, but also with other technology companies. We want to offer an end-to-end solution that covers more of the admin work, and we know that we can't do everything on our own. So you're gonna see a lot of integrations coming, and there's going to be a lot more languages and a lot more customization support for sure in Tally.
Okay. Thank you. I mean, I just have one question. Last question is really more personal because, I'm from Cameroon, born and raised. And, I moved out to Montreal, Canada, maybe 12 to 15 years ago. And I know that you have a similar background. You grew up born and raised in Iran, right?
Yeah.
And all you went to an all girls school, and you mentioned in some of your publications that you've always loved engineering, and you were looking forward to you've always wanted to get into the entrepreneurial journey. Is there any big pivotal moments that you can think about, just from being in Iran in an all-girls school, to being where you are right now, being the CEO of Tali, an excellent, innovative product that is helping physicians. Is there anything that you can share that has been, just difficult or exciting pivotal moment that you've had so far?
No, I think you probably this probably resonates with you as well as immigrants. We have learned to fight. We have learned to find their ways. We have
Yes.
learned to combat difficult situations. It's always been the same for me as well. I have been one of the most privileged to be able to get good education, to come here. I went for my education at McGill. Like I realized that it's been a privilege to be able to do that. But the culture of my family and the schools I've gone to, they all had this value system of hard work and studying the hard and deep and spending a lot of time for what you care about. So I think these are all the values that I brought to Canada with myself. I'm sure a lot of entrepreneurs share this story. I'm sure
Yes.
it resonates with you as well. So I think
Yeah.
that these are very core
Yeah.
values for any entrepreneur.
If we have listeners who are interested in solving problems in the health tech space, um, is there any specific advice? Because yes, every you can be an entrepreneur in any domain, but I find healthcare is just a different ball game, right? You need to be looking at it from different eyes, or have a different mindset, and so on. Is there anything that you would like you would put out there in terms of someone who's trying to solve a problem based on your experience?
I would say when the problem is real and the market is big enough, you will find the solution. Like it will be just a matter of time. I would not risk take the risk of the market, as VCs usually say. Like if it's the market is too small, not as many people want your solution. Even if you build it, don't go after it. And if you think the problem is just a nice to have, something people really don't care about, but if
Yeah.
it's good, yeah, for sure. Like I wouldn't spend my time on there as well. But when you have a hard problem, something that people are suffering from, and there are enough people suffering from the problem, that's where you spend your time, and you will always find the solution. Like there's it with time and persistency, you will always find the solution.
Awesome, Mahshid. Thank you so much for joining me today. I know that you write newsletters on LinkedIn. So for people who are interested to just knowing a little bit of what you talk about, and what's your handle on LinkedIn and any other sites that they can follow you.
No, LinkedIn is the best place, but they
Perfect.
can also join our community.tali.ai, or join our Instagram, YouTube channels, and these are all where the conversations are happening.
Amazing. I'm gonna write all of that in the show notes. But again, thank you. It's been amazing, and I'm sure we're gonna talk soon. And have a good rest of the day.
I appreciate your time.